Good afternoon. It is May 27th. We're here with Dr. Teresa Frankovich for the media availability. Why are nail salons not included in the state's guidelines for early reopening since they do not involve touching a customer's face?
Well, I get the confusion. I think it is a little bit of a problematic distinction, frankly. I think some of the concerns were the extended period of time compared to, for instance, a quick haircut, and also the sort of holding hands, touching hands, that kind of thing. But I think there are some innovative solutions out there for how people can address some of that risk in that setting. And I think that nail salons, obviously hair salons are not open yet in our area. It's very possible that, those things, because movement has been happening fairly quickly at the state level, it's very possible that those two things will be something that can open together when we're ready.
Have officials discovered how the staff member at Alder Bay who became ill with COVID contracted the virus, and what is being done to prevent this from happening in other senior living facilities?
So in this instance, it was attributed to community transmission, which means we don't have an associated known contact that initiated the chain. And so again, it comes back to that point where we are assuming, and we have good clear evidence that COVID's circulating in our community. Therefore, healthcare workers and others are possible victims of getting a COVID infection. So what we're trying to do as an additional assistance is really encouraging these facilities to have staff screened periodically for infection, as well as putting in all of the source control efforts that they have in place, such as screening employees coming in for work, doing temperature takes, using all preventive equipment, and really putting all the preventative measures in the facility to help decrease transmissions should someone enter the facility who's infected.
Thank you.
Thank you.
Are you observing any trends in demographics of who is catching and surviving COVID-19 here at Humboldt?
Well, I think, with our cases so far, I think we can certainly say that people who are older and who have underlying health conditions are more likely to have more significant disease. It's not universal, but it's similar to what we're seeing in other areas of the state and the country.
What safety protocols would you recommend to dine-in restaurants and places of worship that are planning to reopen?
So a few things. In places of worship, obviously there are concerns about bringing together groups of people who are not usually with each other in terms of disease transmission. And so I ask faith-based organizations to look really closely at their services that are planned and look at things like social distancing, cleaning, a lot of the measures about activities that should and should not occur that are higher risk, and really go with those guidances. I would also ask them to strongly consider using a sign-in sheet for people attending services, just so that if we do have a case that emerges related to that setting, that we have an ability to do some effective contact tracing to protect everyone. In terms of restaurants, I think, again, there's pretty comprehensive guidance available for restaurants about how to operate safely. But both for restaurants and places of worship, I want to encourage people who are older or have underlying health conditions to strongly consider whether it might be better to stay at home and access services, for instance, through electronics or phone, rather than attending, and same with dining, at least as at this point in time. Eventually everyone will have access to those things freely, but I do want to protect people who are most vulnerable right now.
With the influx of marijuana laborers, from a public health standpoint, what risks does this influx pose to our community? What sort of protocols could be put into place to mitigate those threats?
So, there is guidance available. There's agriculture guidance that's useful for this setting as well. Obviously, there are concerns both about laborers who may be coming in from outside areas. And again, we've put out information asking that people make it clear to new individuals arriving that they are obligated to follow shelter-in-place orders and other orders from the state and locally, that they need to quarantine upon arrival for 14 days. And of course, the preference is that we not bring in people from outside if at all possible in this. But I think employers really do have an obligation to protect both their workforce and the community by making sure safety measures are implemented. We know that congregate settings are a risk for everyone.
Regarding the public information updates on positive cases locally, can you tell us anything in a general sense, not specific to individual cases to avoid HIPAA concerns, about the therapies or treatments for local patients and how many ICU beds are currently occupied around the county, how many current hospitalizations, and if a ventilator has been used for treatment, etc.?
So we do have available in our area both remdesivir and plasma, convalescent plasma, as therapeutic options, so that is available within our county. We have, I believe we reported 12 hospitalizations yesterday. We have had individuals who have required ICU care, and we have had individuals requiring ventilation in this, and of course everyone's aware that we've had 2 deaths related to the COVID.
Among active cases, how many unlinked chains of transmission have currently been identified in Humboldt County? And can you please specify the origin of each and how many confirmed cases are linked to each?
Well, it's interesting because case investigations, particularly large ones, evolve over time. And what I would tell you is currently I believe we have 3 to 4. We're still trying to definitively make that decision between the 3rd and 4th. That's when we look at cases over our last 14 days. We haven't really attributed the specific number of cases related to each, and of course that changes with time and incubation periods. But I will tell you some of our cases have had more than 10 additional individuals related to the original contact case.
You have spoken recently about unnecessary travel and social gatherings being linked to the recent spike that has resulted in several dozen confirmed cases over the past 2 weeks. Can you specify how many of those cases have been linked back to travel and gatherings now allowed under your shelter-in-place order?
So first I want to point out that we are not allowing gatherings under the current shelter-in-place order. The governor has made an allowance for places of worship at the state level as well as protests, and we are doing the same. But other than that, we have not specified gatherings for people outside the household unit, although I would like to get some, hopefully soon, guidance soon about that, because I recognize that's really important to people. But we have not at this point allowed that. In terms of cases related to travel and gatherings, what I would tell you is that we have at least 2 of our current chains are related to travel. We've had multiple contacts from both of those chains that have become ill in addition, but I don't have a specific number to give you at this time on that.
Thank you, Doctor.
Thank you.